All right there. Hello, friends. Welcome to your digital CPT codebook tour. Let's first talk about what CPT stands for. CPT is current procedural terminology. So it is the standardized coding system that we as medical owners and coders use to report the procedures and services that providers perform. So this could be everything and anything from an office visit encounter all the way through radiology service to a blood draw to psychotherapy, right? This book houses all of those services, and all of those services are represented by a 5-digit code. Okay. All right. These codes, by the way, are maintained by the American Medical Association, AMA. These codes are also used for professional billing. So professional is the type of service. So we're talking anything in the outpatient realm. Doesn't have to always incur inside of a doctor's office, right? There's all different encounter types, okay? But they would all be considered outpatient. Outpatient just means that you have not been admitted to a hospital. If you are inpatient, there's a whole different set of codes that are used. All right. So let's start first. I'm going to take you through a really quick overview of your CPT manual. When you first click to the next page, for lack of a better word, after the front cover, you're going to see this index or this little, what I like to call a little cheat sheet. So the first thing it introduces you to is the types of symbols that you might see listed throughout your book. So symbols aren't codes, right? But they are guides for you as a coder, right? To know what it means if you see this next to your code. It doesn't, so for example, when it says revised code, that's just telling you as a coder, hey, this used to be have a different description, right? And now it has been revised. Sometimes it's a little more clarity, maybe more, anatomic, maybe more, detail, or more services are grouped to a single code. It doesn't affect you and your coding. It's just saying, hey, there's been some revisions to this code. If it's a new code, doesn't change your choice of code you want to select. It's just telling you, hey, this code didn't exist last year. I'm new, right? Okay. If you see a code with a plus sign next to it, here's another good one for you. This does matter in your coding. If you see a code with a plus sign next to it, that plus sign means it is a add-on code. Add-on codes can never be coded alone. They're like a child. They're always going to have a parent with them, right? All right, that's all you need to know about add-on codes. And then you're going to see, this is just what I call a cheat sheet list of different, what we call modifiers. Modifiers are also not codes. However, they are used when a modifying circumstance occurred during a routine service. Okay. And I'm going to just use this one as an example. Modifier 22. Let's say that a procedure typically time involved for a procedure is 30 minutes. Doctors goes in, starts working on the patient. The patient has lots of scarring. He had to cut through a bunch of scar tissue. Then there was excessive bleeding. And all of this added up to increased procedural services, time, equipment, supplies, all the good stuff. That doctor should be reimbursed for that because that isn't part of a standard routine procedure, right? These were things that they weren't expecting to encounter, but here we are, right? And it took us an extra 45 minutes to an hour to do a typical 30-minute service. This is how that doctor is going to get reimbursed for that extra time and intensity of their service, okay? Doesn't change the service. It just says, hey, more was done than typically required, okay? And I want to get paid. All right, because all of these codes drive revenue. They're little money trains. Choo-choo. Seriously. So pay attention to what you code because there's a big difference in how somebody's going to be reimbursed for a simple procedure versus a complex procedure of the same type. Really quickly, well, I'm going to talk about that. Let's talk about, for example, you go in to a doctor's office and you got a cut on your hand, right? Well, depending on how deep that cut is, depends on how intense that repair is going to be. So if it's superficial, let's say the reimbursement is $100. But if that cut goes all the way down to the deepest level of our subcutaneous, layer, well, the layers that have to be sutured to make that repair, complete is going to be more labor intensive. So there's different levels to repairs and different cost reimbursement costs for each one of those levels of service. That's why it's so important of our attention to detail as to which type of or level of service that we select, and paying attention to the information that we were provided detail wise in the documentation. So we're selecting the appropriate code that represents that most closely represents the service provided. That way the money's right. Okay. All right. Now let's get into evaluation and management. All right. So this is going to be the first section in your CPT book. And the reason evaluation and management comes first, there is an actual why, is because every encounter starts with an evaluation from a physician, right? So I'm going to go back to the cut on the hand, right? I'm going to go to a doctor and I'm going to be like, help, I cut my hand, right? That doctor is going to look at my hand, evaluate, okay? Maybe clean it up, kind of see how deep it is. Now, at that point, they've evaluated the situation, and now they're going to determine how they're going to manage it, right? So this is where evaluation and management, the two pieces come together. The evaluation is just that initial encounter. Hey, I got a problem, right? Doctor says, let me take a look at you. And then he says, oh, I'm going to manage this by suturing you. Now they've had a decision on how they're going to treat my problem. And depending on the complexity of my problem depends on the level of evaluation and management service code that would be supplied. Now, evaluation and management doesn't just happen in a doctor's office, okay? So let's look at all the different areas where evaluation and management occur. They occur in your office, outpatient type of service. Evaluation and management can even be video conference or over the phone, okay? There are codes that can be used for telemedicine. Evaluation and management happens in observation hospital settings. Evaluation management happens during a consultation. Those would typically be with like a specialist. So if you were to be referred out to a specialist by your primary care doctor, or for a specific condition, you may have a consultation with a specialist. Let's see what else we have. Emergency department, that's outpatient, right? So you're still going to use CPT codes, evaluation management codes, to represent even a encounter evaluation in an ER. Other areas that I want to just touch on really quick for evaluation and management, a patient doesn't always have to have something wrong with them to have an encounter with the physician. So let's talk about annual exams, preventative exams. This also falls under evaluation and management. Nothing wrong with you. You're just here for your annual checkup, right? There's still codes for that, right? And then this would be the codes that would represent a preventative exam. And again, it's always going to be broke down into whether the patient's new or established. And you can see that isn't just one single code to represent a preventative service. It's layers. How old is the patient? Right? Are they new? Are they established? Was there additional risk factors involved? And so again, if there was preventive medicine counseling, okay, then it even tells you, hey, you can actually code this separately to the preventative service. So you're always asking yourself, you're trying to get to the nitty gritty, little details. what type of procedure or service was being performed, why it was being performed. Why is always important, even though your reason why is going to be reported from your disease book, your ICD-10 book. You will never bill to an insurance company with just a procedure code. It's always going to be what the problem was and how they manage that problem, right? So the problem is a laceration to the hand. There's going to be a diagnosis code for that laceration, and then there's going to be a CPT code to represent how that hand laceration was managed. Complex, complex repair of a 7.5 centimeter laceration. That's the level of detail that you want. And there'll be a code that represents that level of detail. And that is what's going to, again, coding is all about getting to that highest level of specificity, okay? Getting real granular with things. The more vague, the more opportunity for insurance companies to say, I'm going to hold back on paying you until I have more information. We don't want that, right? All right. So moving on, let's get to the next section, which is anesthesia. And the reason anesthesia, so again, I'm just scrolling through my table of contents here. Just going to click right on anesthesia. Again, we're in a new section. You're going to have new guidelines, and these are specific for anesthesia services. Now, anesthesia has its own section. Why? Because anesthesiologists bill separately from surgeons. Surgeons can be anesthesiologists and the surgeon at the same time, but typically you're going to have an anesthesiologist monitoring the patient while they're sedated, heart rates, vitals, all that good stuff, while the surgeon does their job, right? So you got one person monitoring this patient, keeping them alive, right, while the surgeon is doing their part to fix the patient. And so, again, you're always going to have anesthesia will always be separate. Okay. All right. And unless you work for an anesthesiologist, you're never going to bill for the anesthesia component out of this code range. Okay. Typically, we're just billing for the surgeon services. Again, unless you work for an anesthesiologist. All right. Now let's get to the biggest, largest section in your CPT manual. The surgery section. All right. So your surgery section got some guidelines here. Definitely recommend checking out these guidelines before you get started coding from your surgical code section. Your surgical section is broke down into body systems. So you have a lot of guidelines. Again, just scroll through it. Your guidelines are always going to list all the unlisted services, depending on the body system. But these unlisted services are also included in each section as well. So I'm just going to scroll forward and get us to the layout of your surgery section. Your surgery CPT code section is organized by body systems, and they're also typically organized from head to toe, or in this scenario, from the outside in, right? So integumentary is your skin, so that's on the outside. That's where we're gonna start. And then after you get into each section, right, or body system, then it's going to be based off of, because your integumentary system, right, you got skin from the tip of your head to the tip of your toes, right? And then of course then your skin goes into deeper layers as well. So then you're asking yourself, okay, what part of the skin, and what were they performing? Well, if they're doing a let's say this one 10035, that represents a placement of a soft tissue device. Okay. And then how many, and then first lesion. So again, when you see green, that is a body system. Red is the specific section that the following codes are representing. And then anything in blue is the type of procedures that can be performed to that particular subsection. So to the skin, subcutaneous, and accessory structures. You can do introduction and removals. There's some incision and drainage codes. Debridement, wound debridements. Again, you're also going to have extra guidelines. Always read these, right? This is really important because this is what takes you from being a basic coder to next level, right? For example, if you've got multiple wounds that have to be debrided, the code book is saying, hey, if you're doing debridement of a single wound, we want you to report the depth using the deepest level of tissue. So if you've got, let's say I've got an arm road rash. This is a good one. I've seen this in urgent care before. Patient came in, e-bike, got road rash all on their arm. Well, there was some parts that were a little more deeper abrased than others, right? So they're telling you code the deepest abrasion level, right? Because guess what? That's going to be the most complex. That's going to be your most money. And then it says in multiple wounds, you're going to, if they're all in the same area, you're going to do a sum of all those wounds of the same depth. And don't combine sums from different depths. So paying attention, is this depending on the depth? So they talk about, was there soft tissue? Was this genitalia? Was this muscle, fascia, right? What was being debrided? And then the depth of that debridement. That's basically what they're saying, without getting too deep. Okay. All right. And then again, every section that is in bold blue is going to be a different type of procedure or set of procedures that can be performed, again, still representing that original body area. And then it gets into, different types of, biopsies, different types of repairs. So I was just talking about the laceration to the hand, and we were talking about different complexities and how it drives money, right? So there's a big difference between a simple repair, an intermediate repair, and a complex repair. And you don't have to guess. It defines what each one of those are. So when you're reading your surgical report or your provider's chart notes, you could easily identify just based off of the description of the service and then reviewing the guidelines. All right. Keeping it moving. I want to keep this video as short as possible. Okay. So the next section is going to be your musculoskeletal section. Okay. And it has its own, again, all its own specific guidelines. And you don't have to read all these guidelines at once, right? It's just if you're coding from a particular section in your CPT book, make sure, see if there's any guidelines that are representative of the codes that you want to apply. That way you know you're doing it right. Because your CPT book is the foundational set of rules for application of these codes. And then when you get out in the real world of billing, right, you are also going to be focused on the specific insurance carrier policies that they may have that are specific to the code set that you're billing for. So levels, right? And I also like to tell students, look at these guidelines. Think about it like if you were to card game, board game, anything but you're going to play that's got pieces and different, different point values, whatever that looks like, right? If it's a new game, you got to read the rules so you know how the pieces move, right? How to play the game. Guidelines are literally that, right? It is literally telling you how to use these codes so you can play the coding game, right? So we can get money back. All right. Quick run through, just guiding you through all the different sections of your surgery section. Broke down respiratory, cardiovascular, hemic, lymphatic, mediastinum, digestive, urinary, men genital, reproductive, intersex, female, maternity care and delivery. These are all the different sections of your surgery section, okay? endocrine, nervous system, so your brain, spine, all that good stuff, eyes, ears, and then that is it for surgery. All broke down by body systems, and then each represented by a unique group or range of 5-digit codes. All right, now radiology is next. Now we're out of surgery. Now we're talking about separate individual types of services that can be performed on multiple different anatomic sites, right? So you're being introduced to radiology in your very first week. So I'll spend a little extra time here. We call this the 70,000 series. So every range of codes is 5 digits, right? So your integumentary starts with a 1. We call that the 10,000 series. Musculoskeletal, for example, starts with a 2. I call that the 2,000 series, or sorry, the 20,000 series. Radiology would be your 70,000 series. All right, same pattern, right? We're once you get past, so you got guidelines just like any other section, definitely worth a read, right? And then and then it gets into the specific types of radiology. And if you want to get into those individual sections, just click on this little blue arrow here, boop, and then it breaks it down. And this goes for any section, right? You click on it, and then if there's additional subsections, you'll see a little blue arrow. All right, so you can see that radiology is just kind of a general category, and then it gets broke down into types like X-rays, which would be your diagnostic imaging, and then it follows that pattern where it's going to start from head to toe. So it starts at head and neck, and any accessory structures that are within your head, right? For example, eye, mandible, facial bones. Salivary glands, your temporomandibular joint, right? That's all part of the head and neck. All right. And then it moves into diagnostic ultrasounds is a different type of radiology service, right? And then it's going to start again, same flow. So you're always asking yourself, what type of service was being performed? Okay, ultrasound, awesome. What was the anatomic site? Head, neck, abdomen. It could be and then or obstetric versus non-obstetric ultrasounds. Okay, well, what's the difference? Well, you got to be pregnant to have an obstetric ultrasound, right? So make sure you're always taking that time to triple check the definition of the service that you're going to represent or provide. All right. Everything in green is just different subsections of your general category radiology. Guidance, that would be with like fluoroscope, CT scan guidance, MRIs, mammograms, joint studies, oncology, and nuclear medicine. All right. Now, that is your 70,000 series. Next up is going to be what we call path and lab. Still got guidelines. And then we get into the different sections of path and lab. There's disease and organ panels, there's drug assays, there's clinical path consultations, urinalysis, molecular pathology, genomic pathology, blood chemistry. So chemistry is going to be like, they do a complete blood count, right? Or check your ketones in your urine. Even things like hormones, right? Like aldosterone or testosterone, a PSA, a prostate specific antigen test, right? Those are all chemistry tests. Hematology, immunology, transfusion. This is all pathology. So we call this the 80,000 series, okay? And then let me move us into, I want to get to the very last large section. So after you get past your surgery section, and by the way, when you think surgery, I want you to think invasive services. Anything, I mean, even a biopsy is invasive, right? They have to do some kind of cutting and remove a piece of your skin, or tissue, or, suspicious lesion. So invasive. They're doing a repair on you. They're excising something from you. They're cutting into you. All of that is surgical in nature. Okay. The next big section of your CPT manual is going to be your medicine section. Medicine, I want you to think therapy. So think about, like, if you're not feeling well and you got to take some cough medicine, right? That's therapeutic, and isn't invasive. So let's get into your medicine section. So still got guidelines. I'm going to move past that. And I want to get you in just to the actual segment. So medicine, think immunizations, think vaccines, think psychiatry, think occupational therapy, physical therapy, dialysis. And another purpose of medicine is also, sometimes we may not know what's going on, so we need to do something diagnostic, like a screening or a study, so we can determine how best to manage this patient. And it may end up being surgery is the right answer, but we need to do something therapeutic first, or we needed to perform some type of a study so we knew what to do next. So they have like sleep studies. This one's an esophageal balloon distension study. Again, diagnostic, test, right? Those are kind of like the key words here. And it's also broke down into body systems, right? So there's cardiovascular test, there's pulmonary tests. So think of a spirometry test. That's a great example of a pulmonary service, right? That's non-invasive. Home ventilator management, all of these things. There's your spirometry right there, 94010, for example. And then, things like allergy. So, there's allergy test, right? So again, that's not really invasive. That's more also diagnostic. We're trying to figure out what you're allergic to. So there's a code for that. Endocrinology, neurology, genetics. Let's see what else we have. Behavioral management. All right, and that's about it. All right, the last thing that I want to show you guys before I end this particular video, and again, I'm going to have a lot more videos that I'll be demonstrating actual coding that you'll be able to follow along with, okay? But I want you to get the layout of the book first. The last thing I want to show you is just the appendices. So Appendix A, remember we saw that mentioned at the front cover of the book. So this is where you're going to get those full definitions of all those modifiers. Appendix B is just a list of all the new codes, deleted codes, revised codes, codes that are exempt from modifier 51, 63. These are all really, really specific appendixes. And to be honest, I probably in all my years of coding pretty much stick with Appendix A. I don't know that I've really used a lot of these appendices, but if you work for a cardiovascular, surgeon, you would definitely be using Appendix L a lot, right? To familiarize yourself or triple check your vascular families, for example. So some of these sections are very specialty specific. And again, unless you work in that specialty, then you would never even encounter any of these additional appendices or code sets. Okay. All right. Last thing I want to show you is your index. Now, as entry-level coders, right? Just getting exposure to the books and just kind of navigating it and identifying like the keywords that you need to look for, right, to identify a procedure versus a condition or a problem. I do recommend that students practice using their indexes as their starting point. Just to get familiar with the different ways that codes or procedures could be listed or represented. So I'm just going to read you the description here. Index. I'm going to go full screen. This is basically the instructions for the use of the index. Now, it tells you right here, it's not a substitute for the main text. So everything I've been showing you up to this point was your main text, just in different sections, right? And that main text is where the code and the full description is. Your index is going to say, if you're looking for a procedure of an endoscopy on of the throat, right? The index is going to give you a single code, and as a recommendation, go look at this and see if this fits what you're looking for, is basically what your index does. Okay. So 4 ways that you can look up in your index. You can look it up by the procedure. So if you're looking at, a chart note and you need to code for a colonoscopy, that's a procedure, right? So and I'm glad it is listed number 1, because I think that's the easiest way to look up a code is by the name of the service being performed. But let's say that you're just like, I am not really sure about what service is being performed. Okay, cool. Can we identify what anatomical site that service is being performed on? Yeah, arm, tibia, femur, finger, face, lip. Okay, cool. Let's start there and see what we can find. You can also look it up by a condition. Oh, it's a hernia. Okay, hernia repair. Or, oh, the patient has an abscess. Abscess where? Abscess of the hand. All right. Okay, let's start there. So it's always going to be a layered process. It isn't going to just be biopsy. It's going to be what type of biopsy, what site was biopsied. And then that's going to lead you to the most granular, most specific code that represents that physician service. Boom. Okay. Now, everything is listed alphabetically in your index. Okay. And then all of the all of the links in blue, or excuse me, all the codes in blue are links. So once you find a code that you think matches and represents the service that's being provided, you want to always verify in the tabular and read the full description of the term. So let's just say we gave the example that we knew the problem was an abscess, and the way that the doctor treated it was through an open incision and drainage. Awesome. We had a lot of details. I'm just giving you an example there. And so now I just need to triple check that I'm coding the exact description. So I don't have to go flip back and clicking through the pages. I can literally just click here. And before I do that, also notice in your book, remember I was talking about how every single code range has a different has like a 10,000 series, 20,000 series. So it starts with a different numerical number. So I can see here, this is the integumentary system. It doesn't tell me it's the integumentary system, but I know by the code 11005, I don't know the definition of that code, but I know that any code that starts with a 1 represents the integumentary system. So I know that particular service is representative of that anatomical site. Same here. Ones. Now look at this. Oh, now we're into our 2s. Okay. So if you wanted to go see what system that was or body system, you just click on the link and then you're going to see, okay, now we're talking, let me go back 1 page. Now we're in the musculoskeletal system, and we're doing that means that you're going deeper than your integumentary, right? And then those particular codes, again, depending on the service, when you click on the link, it'll take you right over where those codes are in the tabular sections. That way you can read the description in its entirety. All right, so I want to go back. Oh no, not back all the way. Oh man. Not quite what I wanted to do. All right. That was not what I wanted to do. But I'm back at my bookshelf. Okay, so and that was really the gist of this video. Just a quick, well, not that quick, but I had to take you through a tour of just a general layout of your CPT book, what the purpose is, how to look up a code from the index. Most importantly, guys, just remember that CPT and ICD, it's not about memorizing all of these codes. But it's about knowing how to navigate through your books, where to find these codes to represent the services that are being listed by your doctors, and and how to apply things correctly. So take a deep breath. I'm going to too. And I'm going to see you back in an extra tutorial after this one. And I'm going to do some practice coding, and I'm going to use my index, and I'm going to show you a couple different ways that you can look up codes. Control F is our friend as long as you know what you're looking for. All right, friends, I will see you in the next episode. Have a great day.